I'm Sarah Eccleston, and I'm a student in the Adult Gerontology Clinical Nurse Specialist program at Widener University. There are several reasons that I chose Widener, and I looked at a lot of different programs, but one of the big one is their connection and reputation in the military, specifically the Army Nurse Corps. I'm an active duty Army Nurse Corps officer, and so when I was looking at programs, you kind of look in that, you were looking at different ones that would support your track that way. And I just remember the first time that I emailed Widener, I got a response right back from the director. And so that was kind of neat. It really made you feel like a person, like, wow, I got a response back from the director right away. Because I was looking at the program to see if they could work with me as an Army officer and then also a nursing student coming in an advanced practice role. And so that was one of the big reasons I felt they were interested in me as a person. I got that kind of small, close-knit environment feel just right from that first interaction. And then they were very flexible. Like, I had to continue to communicate with them on multiple levels of, can we get a full-time program set up for me? Can I complete it in this time frame? And so they were able to do that. I felt like the CNS role was that little bit of everything. I got to do direct patient care, continue to work with patients, but I also got to do staff development and work with staff. And then I also got to do kind of the big picture organizational quality piece. And I felt the CNS role fit all that in. So when you're considering the different roles, the nurse practitioner versus the clinical nurse specialist versus the anesthesia, kind of nursing anesthesia set, or you're looking at nurse midwifery or the women's health, those are kind of the four roles you can select. And then you have to look at yourself and see what it is you're interested in. And I was most interested in the CNS role. So that's kind of why I chose the adult gerontology, the clinical nurse specialist role, and Widener personally. So when you're thinking about hands-on in nursing, it is very hands-on. So I kind of look at it in two different methods. So there's the hands-on before you get into the clinical piece. So you've got your didactic portion where you're in the classroom and learning from that. And I do think that you need to consider that as hands-on because you have different laboratory or lab times, and Widener has a really great lab in a brand new building, so that's helpful in our development as an advanced practice nurse. But we work in that environment with our health assessment courses and whatnot to kind of really develop those advanced practice roles before we get out into the clinical environment with our preceptors and different clinical rotations. So I think that's one method of hands-on before you actually get into clinical. And also in classroom setting, when you're talking about leadership classes or you're talking about your research course, those are also hands-on because you're doing presentations, you're interacting directly with the professors, you're interacting with your peers, and you really do have a hands-on portion of that. You're going over to the library and learning how to do research and making sure that your presentations are evidence-based, and those are all kind of the hands-on things that I see in this advanced practice role. The second method, and one of the most important ones, is clinical. So you have time to actually go out, work with the experts, work with the people that have been in that role, the clinical nurse specialist role or the nurse practitioner role for several years, and you get the opportunity to see what it is you're really going to be doing, or you get the opportunity to see what it is other people are doing, and then you can kind of take a little bit from each clinical rotation, and that's fabulous. I really enjoyed the time. There's not a ton of professors, and so you really get to know each one of them individually, and picking a mentor, asking questions, and having a mentor in one of them is very easy. And you could have a professor one semester, and the next semester you see them walking down the hall and they're calling you by your first name and asking you how everything's going and how you're doing. And so that's something that I really enjoyed here at Widener. And kind of my next plan after this, after graduation, is I will be working in a active duty Army Nurse Corps hospital, specifically in Fort Lewis, Washington, which is in Seattle, south of Seattle at Madigan Army Medical Center, and I'll be doing the CNS role kind of in multiple different units.